Okay, when you set up a BiPAP, it's going to be because somebody's hypercapnic. Their CO2 is too high, they're having ventilatory failure, and maybe even oxygen failure. Their O2 may be low whenever you get that ABG. So you'll set your IPAP. That will help get rid of your CO2. And then you'll set your EPAP. Again, EPAP is PEEP, which fixes O2. And then you're going to set a respiratory rate. So you'll set your IPAP, your EPAP, and a respiratory rate. Now, last chapter we talked about something called sensitivity, which is the same thing as a trigger. And these machines do not have very good sensitivity at all whatsoever. The patient could be trying to get a breath and the machine does not recognize it, or the machine may be trying to give a breath when the patient's trying to exhale and again doesn't recognize what the patient's doing. So I usually set the rate as low as possible for patient comfort. If they can't breathe on their own more than 12 times a minute, they probably need to be intubated anyway. So, as this says, you might have settings of 20/10 with a rate of 4, with 20 being your IPAP, 10 being your EPAP, respiratory rate being 4. With 20/10, you're going to have a pressure support of 10, because 20 minus 10 equals 10. That means 10 centimeters of pressure support. And then a rate of 4. Now the patient can breathe over that as many times as they want. This PowerPoint slide and the next one are just a review of the waveforms that you'll see when using a ventilator. You can see the pressure waveform, the flow waveform, and the volume waveform. You'll see these with the ventilators such as the Servo I that you've been using in the lab, and also the non-invasive ventilation or the BiPAP machine.